for the generalities of the blood vessels, in contrary to arteries, most veins have valves to prevent reflux of blood. So when the blood flow reverses, these valves close and the blood fills the sinus. They are usually found in the small veins or where tributaries join larger veins. These valves, they are not present in the thorax and abdomen. Structurally, the veins are relatively thin-walled as compared to your arteries of similar size. And because it has larger diameter, 80% of the blood is contained in the veins, whereas 20% is contained in the arteries. There are three types of blood vessels: the arteries, the capillaries, and the veins. Once the blood leaves the heart, it is distributed to different parts of the body and by a branching system of thick-walled arteries. And the final distributing system are your arterioles, which deliver low oxygen blood to the capillaries. And these capillaries form a capillary bed where the exchange of nutrients, oxygen, waste products, and other substances with the extracellular fluid occurs. Blood from these capillaries will pass into the thin-walled venules, then into the smaller veins, then into the larger veins. So the superior and inferior vena cava are the largest veins that return low oxygen blood to the heart. The main arterial supply of the head and neck is derived from the branches of the carotid and subclavian artery. The anterior cervical region contains the carotid system of arteries, consisting of the common carotid arteries and its terminal branches. The inferior are the internal and the external carotid artery. So this is the common carotid artery and the site of bifurcation, which is at the upper border of your thyroid cartilage. So as the external carotid artery ascends, it gives off several branches to supply most of the structures outside the cranium, external to the cranium. So the first branch is your superior thyroid artery. The ascending pharyngeal artery is the only medial branch and is the smallest branch of your external carotid artery. The lingual artery supplies the floor of the mouth and the tongue. The facial artery, it runs along the lower border of your mandible, in front of your masseter, and approximately 1 cm from the angle of the mouth. So this is the area where the facial pulse can be palpated. The three arteries, the facial, lingual, and superior thyroid, arise from the anterior surface of your external carotid artery. Two arise from the posterior auricular and the occipital artery. Once the artery enters the parotid gland, it divides into two terminal branches, the maxillary and the superficial temporal artery. The internal carotid artery has no branches in the neck. It has a carotid sinus at its proximal area, which functions as a baroreceptor that reacts to changes in the arterial blood pressure. It also has a carotid body, which lies in the medial side of the bifurcation, which functions as a chemoreceptor that monitors the level of oxygen in the blood. As the internal carotid artery ascends, it enters the carotid canal at the petrous part of the temporal bone, where it becomes the main artery of the brain and the structures of the orbit. Clinically, when there is atherosclerotic thickening of the tunica intima of the internal carotid artery, blood flow is obstructed. However, the symptoms manifested by the patient depends on the degree of obstruction and the amount of the collateral vessels involved. So when this is partially obstructed, the patient will develop transient ischemic attacks that will usually resolve within 24 hours. So the branches of the internal carotid artery that supplies the circle of Willis are your middle cerebral artery, the posterior communicating artery, and the anterior cerebral artery. Please take note of that. The subclavian artery supplies the blood to the upper limb. It is divided into three parts, by your anterior ischial muscle. Medial to it is the first part. Posterior to this muscle is the second part, which is short and it is the highest part of the vessel. The third part is the longest and it is the most superficial part of the subclavian artery. Clinically, as you can see, that the third part of the subclavian artery lies on the first rib. So its pulsations also can be felt in this area. So this area also, the third part of the subclavian artery, can be compressed also against the first rib if to control bleeding of the upper limb. The axillary artery, this one, begins as a continuation of the subclavian artery at the outer border of the first rib, and it ends at the inferior border of the teres major muscle. It is divided into three parts by your, what muscle? Pectoralis minor muscle. The first part, this one, it extends from the outer border of the first rib to the medial surface of your pectoralis muscle, and it has only one branch, the superior thoracic artery. The second part is posterior to the pectoralis minor muscle, and it has two branches, the thoracoacromial and the lateral thoracic artery. The third part has three branches, so it's 1, 2, and 3. And the largest branch of the axillary artery is your subscapular artery. So clinically, when there is profuse bleeding in the axilla due to stab wounds or trauma, we can palpate the third part of the axillary artery against the humerus to control the bleeding. So the vertebral artery, it arises from the first part of your subclavian artery. It enters the cranium through the foramen magnum, where it joins the contralateral basilar artery to become a contralateral vertebral artery to become the basilar artery. Most veins of the anterior cervical region, they are tributaries of the internal jugular vein, which is the largest vein in the neck. It commences at the jugular foramen at the posterior cranial fossa as a continuation of the transverse sigmoid sinus. So, not seen in this picture, in its inferior part, it is posterior to the sternal end of the clavicle. It merged with the subclavian vein to form the brachiocephalic vein. So, at the inferior end of the vein, it has a bicuspid valve that allows the blood to flow towards the heart while preventing backflow into the vein in cases where the intrathoracic pressure is increased. So this area, it has bicuspid valve. So the subclavian vein, there are the major venous channels draining from the upper limbs. So for the parts of the aorta, the first part is the ascending aorta. It has only one branch, the coronary arteries. The arch of the aorta is a continuation of the ascending aorta, and it ends by becoming the thoracic or descending aorta. The aortic arch has three branches, the innominate or the brachiocephalic branch. This is the first and the largest branch, the left common carotid artery, and the left subclavian artery. So this one and this one also. So one of the common problems encountered in the arch of the aorta or in the thoracic aorta is the coarctation of the aorta, in which there is abnormal narrowing of the aortic lumen. So what will happen if there is narrowing here? There will be decreased blood supply to the lower part of the body and to the abdomen. So the most common site of coarctation of the aorta is at the ligamentum, near the ligamentum arteriosum. The thoracic aorta, it begins on the left side at the inferior border of the body of T4 and ends at the inferior border of the body of T12, where it enters the aortic hiatus of the diaphragm. So the branches of the abdominal aorta are described as anterior, lateral, and dorsal. In the anterior group, we have the celiac artery, the superior mesenteric artery, and the inferior mesenteric artery. The celiac artery, it has how many branches? 3 branches. The largest one is the splenic artery, and the smallest is your left gastric artery. For the lateral group, we have the suprarenal, the renal artery, and the gonadal arteries. For the dorsal group, we have your inferior phrenic arteries and the lumbar arteries. So the abdominal aorta, it bifurcates at L4 to become common iliac artery, and then femoral artery to supply the lower extremities. So the inferior vena cava, it conveys blood to the right atrium from all structures below the diaphragm. It is formed by the union of the common iliac veins at L5. So among its venous tributaries, only lumbar veins are unique in their connections because not all lumbar veins drain into the inferior vena cava. The fifth lumbar vein, it drains into the common iliac vein, which is it drains into the iliolumbar vein, which is a tributary of the common iliac vein. The third and fourth iliac lumbar veins drain directly into the inferior vena cava, whereas the first and the second, it drains into the ascending lumbar veins, in which these ascending lumbar veins, it becomes an important collateral channels between the lower and upper part of the body in case this inferior vena cava is blocked. Superiorly, the ascending lumbar veins, it joins the subcostal vein to form the azygos vein on the right side, and it joins the subcostal vein on the left side to form the hemiazygos vein. So what do you think is the clinical significance of this azygos system of veins? What's the significance of this? It's an important anastomotic pathway which returns venous blood from the lower part of the body back to the superior vena cava and to the heart when the inferior vena cava is blocked or when there is obstruction. So the hepatic portal system, it conveys blood from the visceral organs to the liver. The hepatic portal vein is formed by the union of the splenic vein and the superior mesenteric vein. So in case of liver cirrhosis or when there is damage to the liver, what will happen to the portal pressure in the portal vein? Increase, meaning there will be less blood flowing to the liver. So what happens next? Since the hepatic portal vein and its tributaries doesn't have any valves, the blood will flow in reverse direction towards your inferior vena cava by way of its collaterals at specific points to the systemic circulation. So at the gastroesophageal junction, the left gastric vein, it drains to your azygos system of veins of systemic circulation, and at the anal area, the superior rectal vein, it drains with your middle and inferior rectal veins of the systemic venous system, and your paraumbilical vein, it drains into your anterior abdominal muscles, veins. So, since there will be greater amount of blood forced through these collaterals, it unfortunately forms varices. So, if you are presented with a patient, a chronic alcoholic patient with complaints of hematemesis or bloody vomitus and melena, the passage of black tarsus, and with these physical findings of distended abdomen, with superficial, with numerous veins and palpable liver, what do you think is your primary consideration for this patient? The patient might have liver cirrhosis. So the patient underwent biopsy, and the result the patient had was diagnosed to have liver cirrhosis, probably secondary to chronic alcoholism. So what could be the cause of the patient's symptoms? What is the probable cause of the patient's hematemesis or the bloody vomitus and the presence of black tarsus? It's due to bleeding of the gastroesophageal varices.
Is that a girl?
So the thoracic duct is the largest lymphatic channels in the body. It originates from the calcistern or cisterna chyli, and it is thin-walled and it is beaded due to its numerous valves. So it conveys most lymph of the body from the lower extremities, from the pelvic area, from the abdomen, the left part of the thorax, the upper limb, the left side, and the left side of the head and the neck, to the junction of the internal jugular vein and the left subclavian vein. The right lymphatic duct, this one, it conveys lymph from the right upper surface of the body, the right side of the thorax, the right upper limb, and the right side of the head and face, and the head and neck. So the lymphatics, it provides drainage of the surplus tissue fluid and leak plasma proteins back to bloodstream, as well as for the removal of debris from the cellular decomposition and infection. So this is what will happen if the lymphatics are non-functional, resulting to edema. There will be more fluid present in the extracellular fluid. Thank you.